If you've ever wondered what a visit looks like to an upper cervical chiropractor, take a look. So during a visit, this is what we call your daily nerve assessment. This allows us to get a real-time picture of what's going on with your nerve system that day. And then after the adjustment, we actually rescan you to ensure that we were able to accomplish what we said we were. Afterwards, we do palpation. With this, we're just looking for inflammation, any problem areas in the neck that we want to be aware of on today's visit. A leg check. Now, when I say we're doing a leg check and we're checking for a short leg, it doesn't mean that someone's leg is actually short, but if the pelvis is off balance, if there's muscles in the lower back that are off balance, it will cause one of those legs to pull short. So we want to identify that because after the adjustment, we will see that leg drop, not because it's gotten longer, but because the imbalance has been corrected. So what we're also doing here is checking the paraspinal muscles, or the muscles on either side of the spine and the low back, and we're trying to identify which side is actually problematic and contracted. So once we determine whether or not someone needs an atlas adjustment that day, we're going to set them up on the table. That is probably one of the most crucial aspects of the atlas adjustment. It is based upon measurements we've taken from x-rays, and that's what allows us to know exactly what position to put them in to allow us to deliver a very effective adjustment in a short period of time. So once we get the person set up on the table, we'll use the ruler to get the appropriate measurements according to x-ray, and then we will actually deliver the adjustment. So this instrument is what we use to deliver the atlas adjustment. It looks a lot scarier than it is, but I'll explain that here in a second. It's very gentle, and it does not require any twisting, cracking, popping of the head, neck, or back. So this is the instrument that we use to deliver the atlas adjustment. It looks like a drill. I assure you it is not. So I'm going to show you how simple and effective it is and how gentle it is also. So what better way to describe exactly how gentle this adjustment is but on a tomato. So watch here. We're going to put this instrument. I'm going to pull the trigger and we just delivered an adjustment. The tomato seems to be okay to me.